I am a lesbian. Pansexual. I'm bisexual. I'm queer.
I'm a homosexual.
Queer. I'm intersex.
Non-binary person.
Bisexual.
I'm a non-binary lesbian.
Pansexual.
Hello, Diversified Kenya. My name is Gaturi Kwame. I am the host for this podcast, and I want to talk about something that's been weighing on my mind. Okay? It's something to do with mental health and how a lot of us are throwing around mental health conditions without necessarily knowing the heaviness of it. And I wanted to have a conversation with an expert who can tell us about, my ADHD, my trauma. You are dating a narcissist, because no one ever is a narcissist. I've never met a self-proclaimed narcissist personally. Everyone knows of one. And we wanted to get to the bottom of what these things mean. And I'm gonna let them introduce themselves.
Okay, thank you. So how to introduce myself? Okay, so I'm Dr. Stacy Njani. I am a psychiatrist and a medical doctor. And I practice here in Kenya, in Nairobi at the moment. And yeah, I think Kwame and I have interacted a couple of times, done some work in the community, and I was happy to be invited. So I hope I can be of help. Call me an expert. I guess I am one. I think I should just accept that I am one. So yeah, I'm happy to be here.
Awesome. So I think my first question to you would be mental health. Because every time it's like, oh, my mental health is in the pits, my mental health. And we've never quite paused and asked ourselves, what does that mean?
Yeah.
Yeah.
Okay, so describing mental health, I think, is not one thing. It's a combination of many things that then give you a state of being. So before I even describe it, I think it's important to know that mental health is a continuum. With everything, it's a continuum. So, and you're always in an extreme or the other, or right in the middle in the nice spot. So when you talk about mental health, the continuum is between being well and being ill. And so you can slide up and down that scale depending on what is happening.
Yeah.
So when you talk about mental health, we're talking about your emotional, your psychological, and your social well-being, and how all of those interact with you and result in how you're acting, behaving, and feeling, right? So when we say you're on the continuum, when you're well, that means you are able to interact with your peers, with your friends, with your family very well. You're able to function at work, whatever your job is. If you're not working, let's say you're a parent, you're able to take care of your kids very well. Because in itself, taking care of kids is a full-time job.
Yeah.
So that also needs to be something you're in a good state to handle. And then when you're not in a good mental health space, then we start sliding towards the scale, towards mental illness. And so you could be at a mild, moderate, and severe state. And those different stages are what will determine what interventions we take and what you're presenting with and where you need to go and who you need to see. So it's a lot of things, but generally I'd say emotional, social and psychological well-being and how that influences the way you're acting and moving through the world.
That is a really comprehensive breakdown, because my next question was going to be, how do you know, because life happens to everyone and it comes at everyone, and I wanted to know the difference between you just experiencing life and when shit has gone to, shit. And I feel like you've already answered that.
Yeah.
So I think I would ask, what are the common misconceptions about mental illness?
Well, there are many. I think there are many, and I'm sure we all know them. One of the most common, I think, is that happens is usually that it is something that you've been cast, right? I've had nimekewa ka kitu, right? So depending, and unfortunately that sometimes is influenced by our culture as Africans, and there's nothing wrong with our culture. I like to bring that up. There's nothing wrong with our culture, but when we start to mix it with being the reasons as to why someone is ill, then it adds some harm to it. So I'll hear people say that you are cursed, it's witchcraft, or I'll hear people say, oh, that's normal. All of us go through that. You're exaggerating. And while things can be common, it doesn't mean they're normal. So many people can be struggling with something, but that doesn't mean that it is normal that we're struggling with that thing.
Yeah.
Other misconceptions, it's hard to think of them now, but I hear many. I think another one is that it can go away on its own, which sometimes is true with stress, but then if it's an illness, an intervention is necessary.
Yeah.
Those are some of the few ones that I've had.
I think for me, I've realized that there's things that we as Africans are very readily, uh, very open to making excuses for. Like, for instance, something like religious psychosis. When it looks like that, when it's in the name of the Lord, then you're willing to, see through it and support it. But when it looks like someone insulting someone at a market, then that is, mental illness.
Yeah.
But someone preaching in a market is praising the Lord. That has usually fascinated me so much because of how, our capacity to just, rationalize some things, while others we just choose to, ignore.
Yeah.
There's this word Nairobians love. Oh my God. Bipolar. The one that acts up a little bit, you're bipolar. You change your mind, you're bipolar. You look at someone, you change the way you relate to someone, you're bipolar. What is that?
Oof, that's a big question. I think to answer that better, I think also to touch on what you've just said, that we excuse some things very easily and others not. I think one of the best ways to identify the difference between what is quote unquote within the normal behavior, and I put quotes because who decides what normal is it affecting your functioning? Those things that I said you have to be able to do, is it affecting that?
Yeah.
So when we come to talking about the bipolar, that's a hard one to just touch on, but best way I can start is by describing where it comes from. So it's a mood disorder. So in mental illness conditions, we have various disorders and we categorize them based on how they present, what causes them. And so you'll hear things like mood disorders, you'll hear psychotic disorders, you'll hear substance use disorders. Those are broad categories, and then we can talk about them under that. So for bipolar, it falls under mood disorders. So we usually have bipolar and depression being the most common of the mood disorders. So when people talk about bipolar, I think when they attribute it to the weather is changing and all of those things, there's a part of it that is
relevant.
Relevant to the description of bipolar, which means that it rapidly changes mood. It's abrupt, it's unpredictable, and then it swings from one end to the other. So that's just a basic description of how it presents. But so when we're talking about bipolar, the bi and the polar means that it's two polarities of the mood. So on one end, the mood presents very low, and on the other end, the mood presents very high. So on the low end is when someone is presenting with depressive symptoms, and on the higher end is when they're presenting with manic symptoms. So as much as we throw it around, it's actually quite a severe, serious condition, and it requires you to be clinically interviewed by a psychiatrist. Assessments are done for you to actually be given that diagnosis. Yeah, that's what I'd say as a description.
I feel like within my work in the peer ecosystem, I feel like this is the most interaction I've had with folks being diagnosed with the condition. And for me, for a large part of my adulting, it was an urban legend. I didn't know you could have bipolar, just someone like me could have bipolar, or you could date someone with bipolar. And then there's so many, online, there's so many misconceptions and fear mongering where bipolar is, concerned. Especially dating someone like this, when they go off their meds and when they are in an active episode and acting out, going through it with the condition. So I feel like I needed to talk about bipolar specifically because even I am skeptical about, let's say, as a professional myself, let's say I need to hire a doctor who also has bipolar, right? Or I have a colleague who I need to work with and they're dealing very sensitive information for queer folk, and this demographic is very marginalized. I wouldn't want to put them in a more in a harm's way. So I feel like this very necessary. So what would you say is the difference between bipolar and depression?
Okay, so I think I do understand the concern that usually comes around generally all of mental illnesses.
Okay.
And I think sometimes while the concern is very valid, it's also a thin line to bringing in the causes and the perpetuation of stigma. Because then you think that if someone has a diagnosis, then it's a label, and once they have that label, then they are perceived a certain kind of way. But the reality is, like I said, there's that continuum, there's that scale where everyone exists. So when we're talking about severity and can you trust somebody who has a diagnosis and all of those things, yes, you can. I think it's just a matter of have they sought out the help, and once they have, how compliant and consistent are they with that help. Those are the things to think about.
That is my takeaway: the compliancy and how much they're following through on their end. Because in order for me to be an ally to something, I need to know like this other person is doing whatever they need to do
their side
on
of the
their
job.
end. So.
Yeah, which is valid. Okay, so to answer your question, difference between bipolar and depression.
Yeah, because depression is a low.
Yes.
Like when does it cross over?
So, and interestingly enough, most people, by the time they get in the diagnosis for bipolar, have initially gotten a diagnosis of depression, and that's because most people, they will present with depression first, and then eventually they'll get an episode of mania. So the biggest difference of the two is that for depression, it's called unipolar depression actually, when you're talking about it in the realm. So with depression is that it'll always only be that. When they have the bouts of the symptoms, it'll always be loss of interest in activities they're usually used to doing, low mood, maybe a lot of crying, sometimes changes in appetite, and a lot of people think it's
basically adulting.
well, it can look like that sometimes. It can feel like that sometimes. But you see, so a lot of people think that with depression is that you won't eat. But interestingly enough, it can mean increase in appetite as well. So any change in your appetite can be a symptom. Changes in sleep, either sleeping too much or not sleeping enough. And I like that you brought up adulting because it is a good question. It's a good question.
Going on.
And I think that's the difference between how do you know normal stress is normal stress and how do you know what you're going through is depression or even bipolar. Because sometimes you're having a really good time and your energy is like up there. So how do we know I'm just having a good time and I'm not having a manic episode, right? So before I answer that, let me finish. So bipolar, on the other hand, you'll have those symptoms during the low episodes, the lack of interest, the low mood, the difficulty doing your normal tasks, but then that will last for a bit of time, and then it'll cycle up without any warning, and it's suddenly very energetic. So it'll be not sleeping at all, a lot of good directed activity, which means that's the day you clean your house. And I'm saying this carefully because sometimes we all have these moments, but you're cleaning your house. 3 a.m. You've decided this is when I'm changing my entire life, right? But there's usually a level that's a bit too much. You haven't slept for 2 days straight and you're just acting. Sometimes it comes with grandiosity. So you believe you are as great as they come. And that also, people ask, okay, but how about my high self-esteem? But obviously, there's what's high self-esteem and there's what I am the president of the nation, right?
1 million others.
Yes, so grandiosity that's a bit above the normal confidence. Sometimes it comes also with dangerous behavior. So someone will spend their money recklessly, they'll get involved in sexual activities recklessly. Drinking, a lot of substance use. So how you know that it is a manic episode and not just I'm having a good day is that those symptoms are all existing at the same time for a solid amount of time. So either a solid 4 days or sometimes 2 weeks, depending on the individual.
So what I'm hearing is we are all cuckoo. But to take it a bit further, do you think the condition can be managed successfully?
Oh, 100%. Well, there's no cure, and that's just the reality of where we are as a field in psychiatry and mental health, that we have yet to find cures for a lot of things. But I mean, even in medicine, there's a lot of things that we treat and manage, but we don't have cures for. So there's no cure for bipolar and a lot of the conditions we have, but you can be very well managed as long as the individual one gets the right diagnosis. So that means that self-diagnosis is not it. You have to actually go and see a doctor and have that conversation. And then once you are diagnosed with the condition, then we include a multidisciplinary team. So we need you to be on medication, and usually that's a mood stabilizer just to balance your mood so it's not going all over the place. And then you need to have a therapist, a psychologist, a clinical psychologist is also very important, because aside from medication, there needs to be a bit of psychological support that happens throughout this person's life. You may not be in therapy every week for the rest of your life, but once you get the diagnosis, it's important you have just to adjust to that and cope with that. And then in periods of stress when you need some extra support. And then finally, it's a lifestyle change. You will have to change how you live your life. Substances will have to be out of the window because those ones will always cycle your mood up and down. So you can't mix your medication, your condition, and the drugs and alcohol, because what will happen is that it will destabilize you a lot of the time. Another type of lifestyle change is having a bit of a routine. So when you are vulnerable mentally, you need to have some structure in your life, because if you have days where you're pulling 14-hour days, then some days 2-hour days, you're not sleeping, you're sleeping, that can result in your brain not resting just generally. And so then you're triggered into episodes of either the low mood or the high mood very easily. So a combination of medication, therapy, and lifestyle adjustment, and it's a condition that's very well managed.
Awesome.
Yeah.
I feel like I'm gonna go on a whim and let you talk to parents, because a lot of people get their mental illnesses diagnosed after they've left the nest. But I feel like, just like anything, it's better when it's caught early, right? So what can parents look out for when it comes to mental illness, and how can they be like at the forefront of supporting young adults who might be going through something like this?
Well,
What are the signs? What should parents
early
look
signs
for?
and symptoms.
Yeah.
I think number one, the thing that makes people different, like let's say you will be fine if something happens, and then I will get depression or anxiety, whatever it is vulnerability. And so that vulnerability has very many layers. Number one is genetic. So some of these things we inherit without even our wanting. So you hear in your family there's somebody who alikuwa anajiongelesha back in the day, or unfortunately you hear someone died by suicide in your family. Those are things that I think families need to talk about. Because if you're not talking about them in the families, when I, as a 21-year-old, start to have struggles with my mental health, I'll think I'm the only one, right? I'll think something is wrong with me. I'll think that it'll pass. I'll just not understand what it is. But if I know that, oh, cousin so-and-so died by suicide, and the first time I feel sad and I feel, hey, that's taken a toll on me, I can speak up and ask for help. And so I'll be able to catch it faster. Or I'll be able to go and tell my mom, hey, the other day I was going to bed and I had a scary thought. And I remember you told me about our uncle. Do you think I should see someone? So number one is, can we have honest conversations about our family history? So if you have any family members who have died by suicide or have struggled with depression, anxiety, any psychosis in the family, any substance use, the patterns, and I know the adults know them, we just hush about them. So we're not telling the kids. So number one is that. And then I think the second one is, don't be a hero as a parent. I feel like sometimes we take on too much, and there's an age that a child would require some assistance, even if they're not ill. There's a lot of transitions that happen in young years, right? You turn 15 or whatever ages, you go to high school. That's a transition stage. You finish high school, you go to uni, that's another transition. Those moments are hard for a young mind. Another one I think would be, if your child comes to you and says, I'm struggling with my mental health, I'm feeling depressed, don't do the thing of giving them a lecture, toughen up, praying it away.
As an ex-child myself, or rather a person that's being weaned off childhood, myself, I think what could have helped me is if my parents paid more attention, because I feel like a lot of people depend with being told something is wrong, that we don't necessarily act on what we're observing. And just a little bit of wanting to know and a curiosity on parents' side, I feel we can save so many young people. Because if you were to wait for the teacher to tell you your child is badly behaved, if you have to wait for the neighbor's kid to tell you that your child has been seen to you are doing what are you doing as a parent? I feel like we owe children observation at the very least, like to observe like something is wrong, to know that there's change in behavior, to know that something is happening with someone. Because imagine all it takes is one afternoon, sit down and you
I mean, there's definitely that.
You get into the room and the children leave. When will you know them?
I get what you're saying. I feel like, yes, 100%. I think being observant and noticing any changes. If you notice your kid who used to play around suddenly is just in their room all the time, who used to eat 2 plates of food suddenly isn't eating, there are those very clear signs. Change of behavior, change in appetite, change in sleep pattern, change in irritability, that your child who used to respond to you very easily is now, lashing out and all of that. It's something to note and be like, okay, let's investigate that. But to be on the side of the parents, I mean, sometimes it's not possible. I have to speak because I see a lot of parents in the room, right? It's easy to say that, but the reality is that the parent who's not able to observe, it's not, okay, obviously, I wouldn't say that all of them, right? There's obviously those ones who are struggling with their own issues, but a majority of parents are trying to figure out balancing breadwinning and doing all of them, making money in this economy to take these kids to school. So they also are receiving the short end of the stick in that they're not able to be present enough because they are attending to other duties. And so that balance can be a bit hard for sure. But yeah, if you are privileged enough to have a 2-parent household and you are stable enough to be able to have the end of the day, everyone comes home and has dinner together, then the responsibility to make an observation is definitely there.
I think I will forever be an advocate for children.
Yeah.
And and childishness. Because I think that the responsibility to bring in bread for parents and to put a shelter over our heads and to clothe us doesn't supersede our emotional needs.
100%.
And a lot of times, even the disorders and the mood swings and whatever could be wrong with young children is caused mainly by their caregivers. And because today's not the day, we're not gonna get into that. Because
No, I do get what you're saying, but I think the reason I had to bring that aspect is that if we look at mental health in the silo and just look at it, what this person needs and the emotional well-being, without contextualizing into the social determinants that we're in, then we also miss the point.
Yeah.
Because then what you're going to be doing is that you're going to be adding a burden to a parent who is existing with other determinants that are affecting them. I'm not saying that it's that they should just provide and that's it, but I am saying that unfortunately, in a lot of social economic statuses, that's all the parent has time for. And then now that becomes a bigger conversation that it's not about this household and this parent, it becomes a conversation about the society we're in, the country we're in, the continent we're in, and how can we navigate all of that and work towards changing that. And then now that becomes, politics, right?
Yeah.
Because the reality is that we can't blame individuals for systemic failures.
That's true.
Because then what we're doing is that we're trying to force people to be better in an oppressive system. And then that becomes, I don't even know where and where,
We don't have the time today.
We don't have the time.
What would you say is anxiety? This babe even went ahead and sang about anxiety.
But that song is so good. It's very accurate. It's very accurate. Anxiety disorders. So anxiety disorders they're part of the stress disorders. And we all experience some amount of anxiety. But then we name it anxiety when really we should be calling it worry. You're worried about, yes. You're worried about the weather, you're worried about your exam, you're worried about, the job
Showing
tomorrow.
Among your friends at
Yes, you're worried about will you fit in with everyone. That's you being worried about something.
Yeah.
When it becomes anxiety is that when that worry becomes pervasive, which means it is there all the time at a very intense amount of level of feeling. So you're feeling this worry constantly, all day, every day, regardless of the setting you're in. So sometimes you have situational anxiety, which can be social, now becomes social phobia, it becomes agoraphobia, it becomes fear of heights, different levels of fears can come in, and now those become phobias. But when you're feeling this worry about everything and nothing at the same time, all the time, then we call it anxiety. And when you come to see a doctor, usually it will be quantified in how many days of the week, for how many weeks of the month, and for how long have you felt like this. And then the second part of the questioning is, how much is it affecting your life? Because I could have worry about something, but I wake up in the morning and I go to work and I do my work very well, and I meet my friends at the end of the day. But at the back of my hand, I'm worried about, I wonder if I'll get paid this month, right?
Yeah.
But then I could be worried to the point where I can't leave the house. I can't go to work. I can't talk to anybody. I can't get anything done. I can't even make myself dinner because I'm just worried something will go wrong all the time. Then now we start calling it anxiety because then it's becoming a debilitating condition. Yeah. So a lot of these things are actually, to be honest, to reduce it in a very reductive way, a lot of mental conditions start off as things that we all experience. But if you're vulnerable and the situation compounds, then it can exceed and become now a mental illness. So worry starts off like that. It can end up being anxiety for people who are vulnerable, and depending on the situation. You can be sad, someone broke your heart, right? But then if you're vulnerable and you have someone dumps you today, get fired tomorrow, then you hear bad news, someone in your family has passed on, and you're vulnerable, then you can end up having depression. So a lot of things is about the severity of it.
Sheesh.
Yeah.
I feel like, as per your explanation, I feel like I've had anxiety like thrice in my life.
Mm-hmm.
Like it puts so much into context. Like a time that I felt so much worry I couldn't do something, function, and it's built over and over and over again. Now I feel like I can count those times. Now let's go into my favorite. Favorite one, the letters, ADHD.
Ooh.
Me, I have a brain cell running this show. I can go into the kitchen trying to make something, let's say coffee, and then I end up doing the dishes. I could have something to do, and then I will keep on pushing it. Something I could do in 30 minutes will be done in a week. Is all of that related? And what does it have to do with ADHD?
Oof, that's tricky because we live in a very dopamine fast world right now. And so it's a very tricky one. It has just become a buzzword, and I feel like doctors are always being trapped with it to talk about it.
So consider yourself a doctor.
ADHD, basically defining it, is attention deficit hyperactivity disorder, and it's a neurodevelopmental disorder, which generally just means that your brain during development, some things shifted and didn't go as planned or as neurotypical brains present. And I think when it comes to the symptoms, the reason it's one of the most difficult ones to discuss and identify is because two different people have very different presentations. Because if you're talking about an alteration in brain development, it could happen in the thousands of, genes and neurons, and it could happen anywhere.
Yeah.
So how it will present in any given person is different person to person. So, but typically, when we talk about it in kids, because that's where it started, that's where it was first identified, and where it's discussed, like proper research has been done. We talk about hyperactivity being that kid who doesn't settle in class. So if you're the kid in class who you're always in trouble, you couldn't sit still, you couldn't not be talking, you could be fidgeting with your things, a restlessness that just exists in the body, and then also a difficulty with sustaining attention. So it's not that you can't pay attention, it's that you can't sustain it for long in one thing. So your attention will tend to shift from one thing to the other. And then it also has other elements. So now, when it was in kids, those are the things that they saw mostly, the attention and the focus, because kids are in school and that's what they want to see being done well. But these kids grow up, right?
Yeah.
You will have to grow up eventually.
You saying that is putting so many things in perspective, because a kid with ADHD is 844 teacher's nightmare.
Oh, absolutely. Those are the kids who are always in trouble.
Yeah,
they are always in trouble.
Hated kids that couldn't sit still and,
And unfortunately, because you see, this is a lot of things that have come to be known with time. When most of us were in kindergarten, our teachers didn't have this information.
They did not.
And our parents didn't have this information.
Yeah.
So all it was is that you were the child being beaten at home and being in school.
Yeah,
But then now at least we are getting to a point where this information is being disseminated out of the clinical space and into the life space. So teachers, parents are getting educated about these things so that they can pick these things a bit early. So if your kid is like that, now we're not beating them. We're being like, okay, take them to a therapist.
Yeah.
Then a child therapist is going to assess them and be like, okay, this one is okay, it's not an issue of that. This one has some learning difficulties, this one has ADHD, and then we're able to take care of it. But these kids eventually grow up. I think that's a thing that for a long time had been missed, and we used to think ADHD was for kids only. But eventually the child will grow up. So those symptoms that you had will shift, obviously. Because one society will, I guess, parent you. You can't be in a meeting and then you just start standing up. And you start dancing in the room because you're just tired of being seated, right? So eventually you find ways to cope with it. You find other ways to move around and deal with that. And you might find that's the person who in the meeting is doodling constantly. Like you look at their notes and then they just have drawings everywhere, or they are playing with their pens. So they will present differently in adults. But generally, it's an issue of having a lot of energy restlessness, and then attention has an issue. So when it comes to the things that you are experiencing at home and wondering, do I have ADHD? It could be, but I think for it to be directly and properly assessed, it has to be done in the room, you with your symptoms and the doctor assessing them one after the other.
Okay.
Yeah.
What? Anyway, until the doctor says so, I don't know. I mean, I just...
And I have nothing against self-diagnosis. I think the issue is yes, exactly. It gets people to see a professional. The issue is self-management. So if you self-diagnose and you see, oh, all of the symptoms I've read in whatever paper, and I always tell people, if you're going to self-diagnose, do the work. Honestly, do the due diligence. I want you to go and look for scientific. I want you to look for scientific content. Don't come and tell me that some babe on TikTok told you. No. Again, nothing against the TikTok babes. They're doing good work. Actually, they're sensitizing people. But when that TikTok babe tells you and you think, hey, I could be, a quick Google search. We are in the age where a quick search will give you a lot of information. Read something a bit more. Go to like the psychological sites that are available, right? That will be something a bit more concrete that you can be able to synthesize. And then now you can go to a doctor and be like, okay, so I was reading all of this and I'm convinced. If you must do it that way. But the easiest is just come to a doctor and ask and tell them, okay, these are my symptoms. What do you think? Yeah.
Okay.
Yeah.
Now that you brought that up, I feel like it's important that we kind of like point you to the right direction. I feel like you can see a psychiatrist at a private hospital, but at the same time, there's really good experienced psychiatrists at Madare, which is a bit cheaper and a bit more
100%.
accessible to everyone. And every time someone thinks a psychiatrist or like getting a specialist to see you is too expensive, I feel like there could be like a middle ground for that. And I feel like public health services like Madare is perfect for that. I'm not saying it's the best.
No, it's actually very good, to be honest.
Yeah.
I trained there. So I think one of the saddest things and realities about public healthcare is that the system itself, and that by system I mean the facility, I mean the waiting lines that you'll end up having to wait, those can overpower and be the thing that people see and say a place is good or bad. But the reality is one of the most equipped in terms of personnel and expertise is usually the public. Kenyatta Hospital, Mathare Hospital, those are the places that have the most skilled labor in this country, because one, they are the place where we train doctors, and then two, it's where all the senior consultants exist. These guys have been doctors for like since before I was born. They're working in those hospitals. So those are the places that you go and you're guaranteed that you're going to find high quality, very well skilled doctors. Skilled doctors. Is there a problem on the other side of you might go and you're 60 people on the queue? Yeah, but that's a problem of the fact that we are still in a country where we're not funding those places very well. So that is usually the catch. You might wait a bit longer. You might be in a space physically, like the facility itself, that feels, oh my gosh, am I that unwell? But the reality is when you sit and finally see the doctor, you're seeing one of the most skilled, very well-trained doctors that there are in this country.
Cool.
Yeah.
I have like the next one will be what are personality disorders?
Oh girl, I can't get into that one. Call me another time. That one is very complicated. That one's very complicated. PTSD, I can describe it generally, but PTSD also falls into ADHD, where people present very differently.
Okay.
But PTSD stands for post-traumatic stress disorder. It's another one we like to use very casually, right? I have PTSD from that, I have PTSD from this. So it's post-traumatic stress disorder. And usually it just means that an individual who has either witnessed, experienced, or even heard of, they actually changed it to even include even heard of, anything traumatic happening, can then present with a certain kind of list of symptoms. And so that usually looks like avoiding things that remind them of that, being very hypervigilant. So if you are, say, in the Mandamano time you were on the streets, right? A lot of people did have PTSD at that time. Because a lot of people had PTSD at that time. You're in your house and you hear something, a loud bang, and you panic. Because you were around gunshots, or you had people who were shot.
The cops are making their way to
Exactly.
the
So, and that's a good example of even the person who didn't go to the streets when it was in their home, because you're watching a lot of it. Anytime you hear loud sounds, you panic a little bit. So avoiding anything that reminds them of that, being hypervigilant and hyperarousable, which means anything stresses you out, startles you very easily, having difficulty sleeping, and re-experiencing those things. Like you might go to sleep and you have a dream and it feels like it's there, or you might be talking and then you say certain words to me that throw me back to that time, and I start to feel like I'm actually in the trauma again. So it's a very severe condition, and has a very clear list of things that happen. And now usually what also now categorize it as PTSD is again back to limiting your functioning. So this person won't leave the house, they're not able to interact with people, they're not able to take care of themselves, they just almost like a freeze kind of a state. And then also they end up having out of normal reactions to things. So you might talk to me and the way I respond to you is so harshly or so aggressively, I perceive threat but there's no threat. That's because my system hasn't recovered from whatever it is that had happened there. So that's a basic explanation for that.
As a mental health practitioner, what is a parting shot you would share with the audience? Because I feel like there's a lot of like taboo, which I'm happy to see being dismantled with this generation, but I feel like we can always like take it a notch higher.
I think I always have a hard time with this parting shot question. Yeah, I've been asked this question before, and I'm like, there's so many things to say.
How would you ask it?
I don't know. I think it's the best way to
You
ask
don't
a
have
question.
any bonus information for us?
I already feel everything I said was bonus.
It was. It really was.
Okay, I'm gonna steal a statement from my partner who was asked this question and said that talking about it helps, right?
Yeah.
And so, as little as with your friend, are you talking about when you're having a hard time? So, are you waiting until it's bubbling over, or that day you have a hard week? Like me, if there's something I'm good at, if I have a hard day, my group chats, they don't even stand a chance. All of them, everyone who I talk to, voice notes, you won't believe what happened today. You won't believe what happened today. Because what that helps is, one, you get it out of your head. And then two, you get immediate support from someone. And that's a space you should also reciprocate, so you're not trauma dumping, right? Yeah. So me and my friends, we have universal consent. This is a place you can come, and if you've had a hard time, you say it. And I can hold it. If you want advice, I can give advice. If you just want to vent, you can just vent. So sometimes I'll send a voice note, I'll be like, I'm just venting, and then I vent, and then I caption it, I am so sorry, listen when you have capacity. Because sometimes it's not even that you want immediate feedback.
Yeah.
You just need
You
it
just wanna
somewhere.
get it out.
Yeah, you just need it somewhere. And not everyone can afford to find a therapist and see them every week, because it's expensive to do those things. So number one is have a support system, and having one means you also create one. So that means you have to be one for someone as well, where you can just talk about hard days, talk about things that are happening. So that would be number one. Talk about it, because once you normalize that, we all feel less alone. And that's going to help move the needle a little bit. And I think the other one would just be, I think it's what you mentioned. We have a lot of resources that are available and affordable and even free resources. Yeah. Use them. Even if it's once or twice, use them. Because I think sometimes that's all you need. You just need a touch point to point out something is severe or not, and then you can be able to continue doing the things that you're doing. Yeah.
That is so dope because, again, as a TikToker, I saw this babe who wanted to rant, and she was she developed software, and then she developed this thing where she wrote all of her feelings, and then she would virtually tear it. So you can always rechannel what you're good at and make that work for you.
100%.
Because not everyone has a group like Dr. Stacy. Some of us are loners, some of us are scared of that information getting out.
100%. Something that's sensitive,
Totally tailor-make it for yourself, so long as you figure out a way to dilute that so that it doesn't choke you and make you feel like all this congestion that could lead to all of these stresses that become mental health later. As always, I've been your host, Katori Kome. See you on the next one.
Thank you.